What I really like about my job is the ability that I have to touch the lives of so many people I come in touch with every single day. We see so many hardships in our lives, diseases, and luckily I'm in a position where God has given me this ability where I can help people, and this is what I really like. I see people day in, day out, and if I can really help them, just listen to them, and maybe treat them, it really gives a purpose to my life. So that's what I really like about what I do.
I think I always wanted to be a physician. I couldn't see myself doing anything else. And the best part of it is most of us love what we do, and this is my dream job.
So what I enjoy most about being a physician is seeing people get better. And many of our patients do get better. Certain conditions respond very well to medications and lifestyle changes and procedures. So when we see those people back in clinic a couple of months after something and they are just feeling like a new person, that's really the most rewarding thing.
So what I enjoy the most is that just the fact you can impact somebody's life, whether it's cardiac, whether it's vascular to help save a leg. That's the most gratifying thing when somebody walks in after they couldn't. That makes a huge decision. The tears out of their eyes sometimes as I can really walk. They don't come in using a walker, but instead of a cane. The small things like that actually make me get out of bed, and it's so enjoyable.
I've enjoyed getting to know lots of families and family members and generations of families from grandparents to parents and children, and helping them become healthier, and it's been a privilege of mine.
I think the same thing that everybody else enjoys is helping people. So in a small community like this, it's not uncommon to see some of those people at the store, or, at the grocery or wherever you're at, and it's good to talk to them, and it's a good smaller community that you can get to know your patients very well.
I think it's been a real privilege for me to have the opportunity to serve with CIS and serve this community and this area of Acadiana.
Lafayette community is a very close-knit community. I see my patients, I know the family. Most of my patients' family members also come and see me. I like the small southern family bond that they have here.
What I like about this community is it's small, close-knit, very family-oriented. I've got 4 children, and some excellent schools over here. So overall, just the camaraderie of this community is excellent. It's very close-knit, and it just bodes well for my wife and I.
I enjoy working in Lafayette because I feel like I'm an integral part of the community. My family is integrated very well, and it's just a nice place to live and a good place to be a physician.
I have been working in this location for 6 years. This was my first job, and I'm still here. But how I came here is an interesting story, because a lot of residents from my residency program had come to CIS, and they just loved their job. And they recommended me that if there is a job you want, you need to come down here. And what can I say, they were right.
My brother lives in Lafayette, and I went to high school in New Orleans, so always wanted to move to the south. So it made perfect sense for me to come back to Lafayette because stay closer to family.
Well, Lafayette's actually close to my home. I grew up in St. Bernard Parish, so a lot of the things I like to do, we can do here, like fishing, hunting, and eating a lot of crawfish. But most importantly, I knew some of the doctors who worked here, and one of my close friends was working here before I did.
So originally I'm from Brobridge, and prior to moving back here, I was in Gainesville, Florida, finishing up my interventional cardiology fellowship. So I've been back in Lafayette now for about 6 years.
I actually chose CIS based off just the balance of work and life, and I had some connections. My wife is from Homa, and she knew Dr. Walker and the rest of the CIS crew, so that was my initial association. Once I visited the Lafayette practice and I saw collegiality amongst the other physicians as well as the nurse practitioners, it just seemed like a good team environment to be a part of.
Interesting story. So after fellowship, I worked with Dr. Walker as his fellow, advanced peripheral, for about 6 months, nearly a year. At that time, I got to witness all the fellow physicians here, how the CIS overall worked, and ultimately that was a good decision for me that helped me decide if this was the right spot for me, and it was.
These 10 years have seen a tremendous amount of growth, not only in the number of patients that we serve, but also in terms of the technology, the procedures we're capable of. I would say a number of years of witnessing the growth of one of the most prominent forces of cardiovascular care in Acadiana.
Yeah, we've grown quite a bit since starting here about 8 years ago. I helped start one of the first structural programs out here in Lafayette for aortic valve replacements, and since that time we've been able to add several new procedures, including MitraClip and left atrial appendage occlusion, all within the last couple of years. And also now we have our own outpatient-based lab, which has been fantastic for treating peripheral arterial disease. So we've come quite a long ways since starting.
So over the past 6 years, we've been able to provide a lot of the cutting-edge technology to our patients locally, which is always very gratifying, so they don't have to seek out care elsewhere and stay close to home.
So procedural-wise, the technology that we have at CIS is amazing. We're always on the cutting edge, especially when I was working with Dr. Walker. We saw plenty of new tools coming out. In fellowship, we really didn't have a lot. We were somewhat coming through, so able to work with the atherectomy tools, the vision tools, the intravascular ultrasound, some of the new procedures with venous work and stuff like that has always been great and very, like I said, gratifying from some of my patients' perspective.
CIS in Lafayette, we brought in aortic valve replacements where they used to change the whole valve, cutting open your chest before by surgically doing it. Nowadays we do it in a small incision through the groin. It's called TAVR. And me and Dr. Salvaggio, we both have been doing it for the last 6 years over here. And you know, we bring technology to a small place like Lafayette, and that's very important.
I think looking back at 6 years, I feel that what we have really done is we have brought advanced technology to this town. I'm very glad that through Cardiovascular Institute of South, we've been able to offer people of Lafayette the cutting edge technology, which otherwise would have only been available in big cities.
So medical technology has advanced in the last decade quite a bit here in the Lafayette community. For instance, percutaneous aortic valve replacement is something that we did not have available when I started, and we've developed a very busy program over the last 7 or 8 years. So that's something that's been a game changer for many patients with aortic stenosis. We also now can treat many diseases simply in the clinic setting. We can do endovascular revascularization of the legs and so forth without the patient having to even be in the hospital. So that's been great for patient care and patient satisfaction. So one of the new capabilities that I'm really most proud of is our intensive cardiac rehab program. So this began in September of 2019, and it allows us to really teach our patients about lifestyle changes that will make a positive impact on their cardiovascular and total health. It's a state-of-the-art facility in Lafayette that really makes people better. And nowadays it even has a virtual option, so even patients who live further away are able to take advantage of that.
I really want to thank my patients for putting the trust in us, and sometimes that's the biggest compliment we can get is the patient's trust. I want to thank all the staff who makes this all happen. Okay, and yeah, I'm just glad I'm here.
Yeah, we're very thankful to our patients first and foremost. We're a patient-centered organization and always have been and always will be. Also, our founding physicians, Dr. Walker, our administrative team really works hard to follow our mission statement to make us a successful physician-led practice.
For us, when we first start out, it's always good to have a mentor, and fortunately for us, Dr. Craig Walker has been an incredible mentor for me, and I'm sure several of the physicians here. It's always nice to have somebody who's been doing this a lot longer than you, guide you in the right direction, and I'd like to thank Dr. Walker. He's been fantastic.
Family number one, of course, and then my wife, kids, mom, dad, of course. And then here, Dr. Walker especially, he's the main reason I'm here and the main reason I can do what I can do. Also, my colleagues here in clinic have just been phenomenal. They've been just a great resource for me, especially in the learning stages coming through, and always been somebody to count on, to ask questions and go from there. So it's something great for me to come out of fellowship, to have the guys that I work with here to learn from. It makes a big difference.
I would really like to thank my patients who've been very kind to me, who have trusted me to take care of themselves and their family members. I would also like to thank my nurses who have always been there helping me take care of these patients, my office staff, Cardiovascular Institute of South, I've really found the job that I always wanted to do, that makes me feel, that makes me want to go to work every day.
Along with this technology that continues to grow every day, we try to maintain as much as possible the human part of treating the patient and maintaining a very close contact with the patient, with their families, and treating them in a very comprehensive manner.
It's been a privilege of mine to be a part of CIS over the past 10 years at the Lafayette General location and provide so much care to our patients locally.
I have had some patients who've, came in initially just barely could walk, legs are swollen and heavy, or they've had wounds on their legs. And after their treatment, collectively between us and wound care, they've come in walking, just tearful, and just say, thank you, nobody's ever helped me. It's very gratifying for me to see that, just to say I can actually help them and really enjoy their life and to the fullest.